Game Show.
2 Nelson schools have closed after staff members tested positive for COVID. Meanwhile, the traffic light system comes into force from midnight tonight. So are we ready? The Director General of Health, Dr. Ashley Bloomfield, is with us this morning. Good morning.
Morena.
You're going to have to put Nelson into red?
No, there's no plan to do that at this stage. We have seen cases pop up in the regions over the last few weeks and through this outbreak, and our approach is, of course, that testing, isolation, contact tracing. And in this instance, that contact tracing has identified these 2 people who were both tested, neither of them symptomatic, and they were identified as positive cases. And so the schools have taken the appropriate sort of actions to make sure that any risk there might be to other staff and students is measured.
Because I guess it's hard because you're in Auckland. And I mean, if you look at the population of Nelson, Tasman, look at the population of Auckland, we've got roughly the same per head of population number of cases at the moment. They're at 85% fully vaccinated. Ours is much higher. Like, what's the difference?
Well, the difference is these are just some isolated cases that have been seeded into Nelson, and that makes it possible for us, as we have shown we can in other areas, in Taranaki recently, Mid-Central, Wairarapa, with contact tracing, testing, isolation, we can get around these cases. And you mentioned that vaccination rate of 85% fully vaccinated. This is the thing that makes the difference here. There is a lot of cover for the population from that high vaccination rate. But you can see also in Auckland that the case numbers have very much levelled off and even look like they might be starting to drop, which is great. Again, this is the impact of vaccination.
Yeah. Did we get the modelling wrong, badly wrong?
Well, the model is not a prediction of the future. It's a guide to our planning, and this is the important thing here.
Why did you put them on big projector screens and pump them across the beehive?
Well, actually, the modelling I've put up on the projector screens has been to show the difference between, in the last week or so, has been to show the difference in what the modelling showed in November and what we're seeing now. So we, of course, have to plan for different eventualities, different scenarios, and it behoves us to plan for sort of worst case scenarios. But in this case, as we're seeing, the impact of vaccination has meant the numbers have levelled off, the hospitalisations have levelled off, and this is great. This is the impact of those high vaccination rates in Auckland.
Is that going to change the way or how much you listen to modelling in the future? Because obviously Auckland's paid a massive price.
Well, I dare say the modelling wasn't the basis for our advice and decisions. The modelling helps us with planning what might happen once there is an outbreak and to plan for that, but it doesn't form the basis of decisions. It just does inform planning and decisions.
OK, Hone Harawira and the border at the north. He says, and he was on the show yesterday, that the local health officials want a border and basically a hard border up with checks to make sure people are double jabbed before going into Northland. Is that the position of the DHB? Is that what they're telling you?
Well, what I would say is I know there's a lot of concern in Tātai Tokoro, and that includes both iwi and, of course, those working in health and those who are trying to get those vaccination rates up. But the decision has been taken based on all the advice that from the middle of December, there won't be a hard boundary anymore, that it will be a requirement that people are either vaccinated, and we can see the rates of vaccination in Tamaki Makaurau are very high now. They're hitting 90% double vaccinated. They either have to be fully vaccinated or have a test, and that is designed to protect people up in Northland and the red level that they have been put into under the traffic light framework also provides a huge level of protection, because unvaccinated people just can't really go to the sort of places where they might spread infection.
No, totally understand that. It just wasn't answering the question that I asked, which was, is the local DHB telling you they want a border or not?
Well, the local DHB has written with iwi to the Minister saying that they would prefer that the boundary stays hard until the vaccination rates are higher.
So what was your advice as the Ministry of Health to the government about that border in Northland? Was it to ignore the DHB's position?
Well, the DHB position has been expressed in a letter that has come since the government took that decision around the boundary coming down in the middle of December.
That's interesting.
Our advice is very clear about the boundary, that high vaccination rates so double vaccination or the requirement for a test, and having Northland in that red category in the new protection framework provides actually more protection than there is currently under Alert Level 2 settings.
But you said all through this pandemic, you have said that you are listening to the local health authorities and their local advice and knowledge. So did you even consult them before you took that border down?
Well, the decision around the boundary was one that the government took. Our advice formed part of the advice around the decision there.
So did you consult on your advice?
We talk every day. We talk every day. We have a meeting every day with our public health units, particularly those who've got cases. And so, of course, the advice from the local, not just local DHB, but other local providers and iwi was listened to, and it informed the decisions. And that's one of the reasons why our advice was that Northland should go into red alongside Auckland as we move to the new traffic light framework.
Right, so what you're saying is actually they did tell you they wanted the border to stay, but you had a different view and advised the government to do something different.
Well, they've expressed a preference. Our advice around how to reduce the risk in Northland was taken alongside advice from other parts of government, and the government has made a decision.
Okay, fair enough. Why are we scanning to get into places in Auckland when there's no locations of interest going up?
Yeah, so at the moment there are no locations of interest going up because the only ones that are open are those ones where we tend to see casual exposures, and we haven't seen any transmission in those sort of supermarket type settings. But as we move into the new traffic light framework, it's very important people do scan, because it's hospitality settings, those closer contact settings that open up from tomorrow, which is great, and that's where we really need people to scan, because if there is a case there, people will be considered a close contact, and we do want to be able to get in touch with them as quickly as possible. So please keep scanning.
But it's just that that's not happening now. So why would it happen from tomorrow?
Yeah. Well, there is a lot of scanning going on still, actually, and we're encouraging people to do that. The reporting will happen because we will be reporting locations of interest where there is close contact, but we've stopped reporting in Auckland casual contact locations. The reason being we just haven't seen any transmission in those settings over the course of the outbreak there.
Okay. All right. We'll have to leave it there. It's 7:30. Thank you very much for your time this morning. As always, the Director General of Health, Dr. Ashley Bloomfield, on the show this morning. Right now, it is 7:30.